Do you have shoulder pain? Have you been diagnosed with something called rotator cuff tendinopathy, or rotator cuff tendonitis, or shoulder impingement, or a partial thickness rotator cuff tear? What do all these terms mean, and how do we treat them? That's what today's video is about. So what exactly is the rotator cuff? The rotator cuff is 4 muscles that attach on different parts of the shoulder blade and come together on the top of the arm bone. The job of the rotator cuff is to stabilize the shoulder. It does this by compressing the ball into the socket. Now, we can injure our rotator cuff if we use our shoulder really repetitively, like a pitcher might, or even in some jobs, for example, or if we lose strength in the rotator cuff over time, as happens with advancing age. And in fact, most of these problems are much more common in our older population. And that's where all these terms come in that I mentioned in the intro. So the overarching term is rotator cuff tendinopathy. And what this really means, what this describes, is a continuum of injury severity. So on the low end of the injury severity is something we call rotator cuff impingement. And in impingement, what's happening is some of the shoulder blade muscles are weak or stiff. Some of the rotator cuff muscles have become weak, maybe with advancing age. And the rotator cuff, or parts of it, get kind of pinched in the shoulder and irritated. Now, if we let this go, it can become, the other term, rotator cuff tendonitis. So here the tendons are simply inflamed and painful. And if we let that go long enough, we can develop a partial thickness tear. Think frayed rope, and it very much looks like that on MRI. So how do we treat this? I generally break these cases down into kind of 3 broad stages. So stage 1, we're looking to, number 1, decrease symptoms. Number 2, improve range of motion. Get the shoulder moving, improve posture. That's a big part of it. Stage 2, kind of beginning level strengthening. And stage 3, advanced level strengthening. And in today's video, what we'll go through is that phase 1. We're trying to get symptoms down. We're trying to improve shoulder and spine mobility to get you back to what you love to do. Before I demonstrate the first exercise, I want to remind everybody, click those like buttons, subscribe, leave a comment. That really helps me grow the channel. So first thing we want to do is actually stretch the mid-back, the thoracic spine. Now, why do we want to do that? Because when we have a more stooped posture, as most of us do, it puts the rotator cuff at a disadvantageous position. It has to work harder biomechanically to perform the same movements. We don't want it to have to work so hard, so we want to have a more upright posture. At the very least, we want to have more flexibility into backward bending or extension. So we simply take a towel, roll it up, put it behind your shoulder blades, lean back, hold this stretch for about 10 to 15 seconds, and do this 5 times. In this next exercise, we're going to directly stretch the shoulder a bit. So as you might imagine, when people have rotator cuff tendinopathy, it's pretty painful to reach. It can be pretty restricted. So this is one way to get a stretch into overhead reaching without actually reaching overhead. So using a chair or hands on a countertop, you simply step back until you feel some stretch in the shoulder, might go into the back a bit. Hold this for just a few seconds, and then step right back up into an upright position. Now, one pro tip, keep your weight mostly on your feet, not on your hands. Okay, so you're not, for example, back here where there's lots of weight on my feet. I'm almost doing a plank. We don't want that. That'll probably be painful. Okay, so what you want to do is simply keep your feet under you, step back in somewhat choppy steps until you feel that stretch. Hold that a few seconds. Come back up to upright. Do this about 10 times. An alternative to the last exercise that works great, that you can do if you have one of these stability balls, is this. So my hurt side hand is on the ball. My weight, my upper body weight, is through my left arm. I'm not putting weight through my hurt side, really. And I'm simply going to lean forward, stretching, gently stretching my hurt shoulder. I'm going to hold that for a couple of seconds, come back, and just go back and forth about 10 times. In this next exercise, we're going to use our foam roller to help us stretch into an overhead reach and to help work some important shoulder blade muscles. So take the foam roller, put it against, in this case, my closet door or your wall, Both hands, both pinky fingers are against the foam and pushing into the foam a little bit. This shouldn't reproduce pain. And I'm simply going to roll the foam up the wall until I'm in a reaching position. I should feel some pull in the shoulder. A little pain's no big deal, but it should not be substantially painful. Hold for a moment and come down. Up and down, about 2 sets of 10. So obviously, again, I'm stretching into a reaching position. I'm trying to improve my range of motion, but I'm also working a muscle called the serratus anterior muscle, which is one of my super important shoulder blade muscles that complements the function of that rotator cuff. In this exercise, we're going to actually start very gently strengthening the rotator cuff. And part of the reason we're doing this in the early part of the program is gentle strengthening, particularly this type of strengthening that we call isometric strengthening, which I'll explain in a moment, actually helps stimulate the tendon to start to rebuild itself. The key is start gently. So I simply have a folded towel against the wall. My hurt side's my right arm. My elbow's not quite touching my ribs, but is basically at my side. And I'm simply going to push the back of my hand into the towel only as hard as I can with no pain. Push, hold 5 seconds, relax. Now at first it might feel like you're hardly doing anything. Fine, don't worry about that. Push, hold 5 seconds, relax. Do this 10 times. This exercise is again another isometric exercise. We're trying to gently strengthen that rotator cuff, but more so we're trying to stimulate some healing in the tendon itself. And that's what these isometric exercises are really intended to do. And again, I can't stress enough, keep it gentle. If you're producing a bunch of pain with these movements, you're probably making it worse. So my right arm's my hurt arm, my left elbow is straight. I'm simply going to gently push the back of my hand into the wall. And again, I'm only pushing as hard as I can with zero pain. So again, most patients, they're hardly pushing at all. And they'll often say to me, what is this doing? Even a gentle push is helpful at this stage of the injury. Push the hand into the wall, hold for a count of 5, relax. Push, hold for a count of 5, relax, about 10 times. This next exercise stretches a part of the shoulder called the posterior capsule, and this is frequently quite inflexible in folks that have some kind of rotator cuff problem. Tightness in this posterior capsule is thought to contribute to some kind of abnormal movement in the shoulder and therefore some abnormal wear and tear. So we want to stretch it out. Here's how we do it. So we lay on the affected side. My right side's my affected side. My elbow is bent 90 degrees, and I'm simply going to gently push the hurt side hand toward my belly button. You'll feel some pull in the shoulder. Hold this for about 20 to 30 seconds. Now, what people frequently do wrong with this is they'll push the hand to the floor, but notice my elbow is straightening as I do that. I'm not getting as much stretch in the shoulder. So again, if you push toward the belly button, you'll keep a 90-degree bend at the elbow and you'll maintain the proper form. Push until you feel a gentle stretch in the shoulder. Hold 20 to 30 seconds. Do 3 reps. So that's what I call my phase 1 rotator cuff tendinopathy home exercise program. These are the exercises I most often use with my patients who have this diagnosis. They have a rotator cuff tendinopathy, they're just starting therapy, they're usually in quite a bit of pain. So the take-home message is keep it gentle. It's a gradual process. The main themes of the program are decrease pain, increase range of motion. I hope you found this video helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment, and we'll see you in the next video.